you so much, Dr. Abdur, and your society for having invited me here to talk. I will do two very short presentations. One is on PDEC and one is on CARES. So I'll just start by sharing. I think please enable screen sharing for me. Okay, so this talk is on corneal allogenic intrastromal ring segments, or CARES, which is an acronym that I coined in 2015. And it was basically to take care of problems that can often be seen associated with synthetic intrastromal ring segments, for example, intacts or Kera rings, where you can get melts, extrusions, intrusion, sometimes even infectious keratitis, and so on and so forth. So I had this idea of basically using allogenic implants instead of ICRS or instead of synthetic implants in 2015. And we published our first series in JRS. The technique, as I said, I coined the term as corneal allogenic intrastromal ring segments. And the term allogenic can be used to refer to any kind of allogenic tissue. It could be fresh allogenic tissue, preserved, processed, donor stroma, or basically any other source of allogenic tissue. So this is how we started off. We used the corneal stroma as our source of allogenic tissue. And this is a special double-bladed trephine, which is patent pending. And I basically use it to punch out a ring of stromal tissue. So just to show this again, I've removed the epithelium and the endothelium from a donor stroma. And then that's the double-bladed trephine with which I punch through. And it gives you this ring of stromal tissue, which can then be cut into two, and or whatever number of segments you want. And these are special instruments that I've just designed. They are basically cataract instruments wise, which have been bent into curve shape, and you can insert this corneal stromal tissue into the femtosecond laser dissected channel, or into basically manually dissected channel also, if you would like to do so. And then this can be followed by cross-linking if you'd like to. So these are some examples of patients who have undergone this procedure. You can see two segments here. Again, two segments here, a single long segment, and again a single long and broad segment. We insert this segment at around 50% depth, which is a big advantage over intact, which has to be inserted as low as 80%. And you can see the well-placed segments here on anti-segment OCT. The disadvantages of synthetic implants, such as stromal thinning, necrosis, melt, intrusion, extrusion, all of these are got rid of, and these are not there with these CARES. You can see the difference between the synthetic and the CARES in this anti-segment OCT picture, where you can see this is so deep and this is mid-stromal. So it's not just that you get rid of the disadvantages of synthetic segments, it's also that you can implant these in very thin corneas, for example, which are those which are less than 400 to 450 microns in the zone of implantation, or very steep corneas more than 50 diapers. We know that these are the corneas where you cannot implant synthetic segments, and these patients would go in for a DAL. And if you can avoid a corneal transplantation in such patients, it would be ideal. And this is where the answer is CARES, or corneal allogenic intrastromal ring segments, because you can avoid TAL and still get very good results with just mid-peripheral implantation of allogenic tissue, as seen here in this picture. So because you implant it at 50% depth, you get better effect, and also it's very easily customizable on spot, as I'll show you. I'm very happy to say now is being done in many countries: India, USA, Canada, Australia, France, South Africa, Turkey, Israel, Lebanon, Dominican Republic, Germany, Ireland, and many others, and many other doctors also starting to do this now. You can use it not just in progressive keratoconus, but also in stable keratoconus, other corneal ectasias. And the best part is you can also use it to treat synthetic segment complications. So here's an intact which had caused an overlying stromal melt. And you can see what I'm doing is removing that. This is the corneal allogenic intrastromal ring segment, which I had punched out using the special trephine. And here what I'm doing is basically just cutting it into the shape, into the length that I want. And I use it to replace that tissue defect, which is created by removing the intacts. And on both sides, it's just sutured into place, and a few bridging sutures are also put in between so that the segment doesn't come out. And you can see that this really gives you a very good post-operative result. This patient has got a intacts on one side and a CARES on the other side, and you can see that this is another patient, and we've just published a series of this on JRS along with Sherry Award, who's also doing a very good number of CARES now, and with very good results. So here's an example of how the CARES gives you flattening. This is a preoperative Scheimpflug image of a keratoconic patient, and post-operative, you can see the CARES implanted mid-stromally and the flattening of the cornea, which is very evident. A few other examples, because this talk is short, I cannot show you many topographies, but just two examples, two eyes of the same patient. Here you can see we have implanted thick cares, and here we've implanted thin cares, and you can see the difference maps. Here you've got a lot of flattening. If you look at this map, this is the pre-op, this is the post-op, and this is the difference map, and you can see that in the pre-operative steep axis we have got a flattening, and also the beauty is you get a compensatory steepening in the opposite axis, and so that gives you an overall regularized cornea. And on the other hand, this patient was so happy, she went for cares in the other eye also, and here you can see the thin segments has given us the very minimal effect that we wanted, and she came to 6.9 in both the eyes. Again, I cannot show you too many topographies, but just very few examples. This is asymmetric cares for decentered cones. You can see the asymmetric or the inferior flattening that we've got. Again here, decentered cone, inferior flattening with some compensatory superior steepening, leading to a much more regular post-operative corneal topography and better visual outcome, improved from uncorrected 636 to 6/9. Even in the previous example, actually the one I showed here, the cylinder had dropped from -7 to -2.5, which is a much more acceptable level of cylinder. And uncorrected had improved from 2120 to 2030. So you get a lot of improvement in uncorrected visual acuity, best corrected visual acuity, a decrease in the spherical equivalent, the refractive cylinder, the topographic cylinder, and a lot of advantages. And the last thing I'll show you in this is basically customized cares, which is what I do now for tailoring the effect further. I must say, as my financial disclosures, that I have a patent pending for the special trifines. So here we can see the epithelium being removed and followed by the endothelium being removed. But as I said, CARE stands for any source of allogenic tissue. This is a trifine, and we have it in different diameters. So what I do is, after the epithelium and endothelium is removed, what you basically have when punching out is a ring of stromal tissue along with the Bowman's membrane. And what I do just to identify the Bowman's membrane site is mark it before removing it from the trifine. So we know that the site with the surgical marker is that of the Bowman's membrane. Place it on a Teflon block, and you can cut it, just flatten it out and cut it into the desired length. And then to further customize it, I've created this degree zone marker, which allows me, which has basically got lots of optic zones and the clock hours, and I can customize it very accurately to the topographic shape. Here you can see I'm marking the clock hours on the care segment, on the long care segment, and then I will remove it from this degree zone marker and cut it to the shape that I want. Those are the marks that I had placed. And basically what we do is cut it. So you've got the first cut, I'm sorry. You've got the first cut done there, and the second cut. So what I wanted here was a tapered segment to kind of suit the patient's topography. And that's what we've got. We've got this tapered segment here. This is the patient's eye. We have created the femtosecond laser dissected channel, and that's the tapered segment cares, which is going to be implanted. You can see that there. And we just basically push it in. The mark also allows you to see the exact position of the segment, and also to make sure that there are no twists. If there are any twists, it's really very easy to untwist it. The same patient showing again the inferior flattening and the steepening superiorly, which gives you more regularization. Some other examples of customized cares. You can see here you've got more flattening in the area which was thicker, and as you go above, since you don't need as much flattening there, you can get you can have the tapered segment placed there. Some other examples of customization, which can be done lots of different shapes to be able to get the best possible results for your patients. So I think with that, I will come to the end of my presentation on cares. And if I have time, I can also show you a very small segment on PDEC, or if not, I can stop with this presentation.
Thank you, dear professor. It was a very nice lecture, but we have limited time, so we thank you very much for this nice presentation. And now we will move. Thank you very much. Thank you to have you with us. Hopefully, we will start this technique in Iraq in the next few months.